Quick question for the men over 30. Why does your sex life feel older than the rest of you? Morning wood fading, erections not as firm, drive a bit muted. Here's the uncomfortable truth. Your penis ages faster than the rest of your body, but it's also one of the easiest things to rejuvenate when you know the levers. Today, I'll show you exactly why it ages early and the science-backed plan to reverse it. Stay to the end for a 30-day reboot you can start tonight. I'm a physician and performance coach. Inside Longevity Lab, we help men restore energy, hormones, and sexual performance without gimmicks. What most guys don't know, your penis is a mirror of three systems: vascular, hormonal, and neurological. Restore those inputs and performance returns. No shame, no magic, just biology you can steer. Why it ages first. The 4 drivers. For reasons the penis ages faster. 1. Small artery effect. Penile arteries are tiny, about 1 to 2 millimeters, while coronary arteries are 3 to 4 millimeters. When plaque, stiffness, or endothelial dysfunction starts, the smallest pipes show problems first. Translation: erection issues often appear years before heart symptoms. 2. Hormonal drift. Testosterone gradually declines with age. SHBG often rises, binding more T. Visceral fat converts T to estrogen. Net result: lower libido, weaker morning erections, slower recovery. 3. Neural plus muscular changes. The pudendal nerve and the pelvic floor muscles drive rigidity and control. Years of sitting, cycling pressure, or deconditioning reduce signal and strength. 4. Collagen and smooth muscle shifts. Less nitric oxide, more glycation. Stiffer tissue equals harder to trap blood, the classic venous leak feeling. Vascular deep dive. Blood flow is king. An erection is a blood pressure event inside 2 spongy chambers. To fill them, your endothelium releases nitric oxide, NO, arteries dilate, blood rushes in, and the venous outflow is compressed. Aging, hypertension, insulin resistance, smoking, inactivity. These beat up the endothelium and reduce NO. Less NO equals less dilation equals softer erections. Good news: endothelium responds to training like a muscle. Do this foundation routine zone. 2 cardio 30 to 40 minutes, 5 times per week. Brisk walk, bike row. Strength training 2, 3 times per week. Squats, deadlifts, presses, pulls. Move hourly if you sit. 1 to 2 minutes of steps/hip hinges to keep pelvic blood moving. Quit smoking, moderate alcohol, manage blood pressure and blood sugar with lifestyle and, if needed, your clinician. Hormone reality check. Libido, sensitivity, and erection quality all listen to testosterone and its potent cousin DHT. 3 levers move T more than anything else. Sleep. Most daily testosterone is produced at night. Even a week of short sleep can dent T. Aim 7 to 9 hours. Dark/cool room. Screens off 60 minutes before bed. Visceral fat. Belly fat is a hormone organ. It converts T estrogen. Lose 5 to 10% body weight and morning would usually improves. Stress. Cortisol and testosterone are rivals. Chronic stress pushes cortisol up and T down. Sleep stack. Optional, if appropriate, magnesium glycinate 200 to 400 milligrams plus glycine 3 gram 30 to 60 minutes pre-bed. Blackout curtains. Keep room cool. Nerves, pelvic floor, and the grip. The pudendal nerve supplies sensation and drives pelvic floor muscles, bulbocavernosus, ischiocavernosus. Those muscles trap blood and maintain rigidity. Sitting on hard chairs, a narrow bike saddle, or years of no targeted training. Expect numbness, weaker control, and faster fade. Protect plus strengthen. Swap hard seating for cushioned. Change positions often. Cyclists, use an anatomic saddle. Stand on pedals periodically. Kegels, 4 men 2 to 3 sets per day. Slow holds, 10 reps times 5s on per 5s off. Quick pulses, 20 fast squeezes. Do lying, sitting, and standing. Breathe. Don't clench abs or glutes. Very solo technique. The same high-pressure death grip can desensitize over time. Habits that accelerate aging down there. 5 quiet saboteurs. 1. Sedentary days. Blood stagnates. Pelvic tissues starve for oxygen. 2. Ultra-processed diet. Sugar spikes, fried seed oil snacks, and excess alcohol drive inflammation/insulin resistance. Endothelium hates that. 3. Porn-induced novelty. High speed, high novelty content can blunt real-world arousal for some men. If you're fine solo but struggle with a partner, that mismatch is a clue. 4. Sleep debt. No deep sleep equals lower T, higher cortisol. 5. Smoking. Direct endothelial toxin, fast tracks ED. Solution: walk daily, lift heavy, eat real food, reduce porn, protect sleep, and ditch nicotine. Nutrition that feeds erections. Eat for arteries and hormones. Think Mediterranean style with targeted add-ons. Load up on nitrate-rich greens, arugula, beetroot, spinach, moreno. Omega-3s, salmon, sardines, or quality fish oil. Less inflammation, better vascular function. Monounsaturated fats, extra virgin olive oil, avocado, hormone-friendly. Mineral-dense foods, whole eggs, shellfish, pumpkin seeds, zinc, selenium, choline. Adequate protein, beef, fish, eggs, body comp, hormones. Pull back on ultra-processed carbs, added sugar, fried fast food oils, heavy alcohol. Hydrate to light straw urine. Even mild dehydration can blunt performance. Smart Supplement Mini Stack, optional. Supplements aren't magic, but a targeted stack can assist the foundations. Always test, don't guess. Vitamin D3 plus K2 if labs are low. Magnesium glycinate, sleep, muscle, stress. L-citrulline 1.5 to 3 gram per day supports NO better filling pressure. High-quality omega-3 per label. Zinc only if deficient. Long-term high dosing can deplete copper. Creatine monohydrate 3 to 5 gram per day, strength, neuro, neutral on T but positive for performance. Caution with miracle boosters. Fix sleep, training, nutrition first. Devices and therapies. What's worth considering? 2 tools I discuss with patients. VD, vacuum erection device, not just for intercourse. Used gently 4 times per week. It's a vascular workout to keep tissue elastic. Low-intensity shockwave therapy. Early evidence suggests benefit for some men with blood flow-related ED. Results vary by provider and protocol. Cool/controversial, red/near-infrared light, and cold exposure are popular. Cold can boost mood/focus. Red light has preliminary data in other tissues. For erections/hormones, evidence is early. Treat them as adjuncts, not anchors. Diagnostics, your check engine list. If performance changed, measure, don't guess. Ask your clinician about hormones, total T, free T, SHBG, LH/FSH, estradiol, E2, prolactin, thyroid panel. Metabolic, fasting glucose/insulin or A1C, lipids, HSCRP, vitamin D, vitals, blood pressure, waist circumference. At home, track morning erections 3 to 5 per week is a good sign, energy, sleep duration, and steps per day. Trends beat guesses. The 30-day reboot, actionable and stacking. Screenshot this and treat it like a training block. Week 1, foundations. Sleep 7, 9H, screens off 60 minutes pre-bed, cool/dark room. Daily 20 to 30 minutes zone, 2 walk. Add a big handful of greens plus olive oil to 1 meal. Hydrate, light straw urine. Week 2, strength and stress. 2 total body lifts, 40 to 50 minutes. Kegels 2 to 3 sets per day, slow holds plus quick pulses. 10 minutes nasal breathing for inches/6 out or evening heat, sauna/hot shower. Week 3, nutrition and supplements. Oily fish 2 times or quality omega-3. Consider L-citrulline 1.5 to 3 gram per day. Replace ultra-processed snacks with protein plus greens. Reduce alcohol. Week 4, arousal reset and nerve care. 30-day porn break if you're mismatched solo versus partner. Fixed seating. Stand every 45 to 60 minutes. Cyclists adjust saddle. Optional VD sessions gentle by guidance. What men report by day 30. More frequent morning erections, stronger fullness, higher drive, steadier energy, and better mood/sleep. FAQs. Handle objections fast. Do I need testosterone therapy? Not necessarily. Many men normalize with sleep, fat loss, stress control, and training. If symptoms persist, get a full panel and discuss options with your clinician. How fast will I notice changes? Blood flow wins show up in 10 to 14 days for many. Hormonal and tissue changes stack over 8 to 12 weeks. Is cycling off limits? No. Just use an anatomic saddle, stand on pedals regularly, and vary training with walks/lifts. Single best diet change? Swap ultra-processed snacks for protein plus grains plus olive oil once per day. Do that for a month. Motivation. Reframing aging. You're not broken, you're adaptive. The same biology that drifted can be coached back. Your penis is part pump, circulation, part sensor, hormones/nerves, and part muscle, pelvic floor. Train those inputs like an athlete. Consistent cardio, smart lifting, real food, deep sleep, stress mastery. Men in their 40s, 50s, even 60s can feel startlingly younger when they stack these basics. Rapid recap. Retention beat. Your 18 again playbook. 1. Blood flow, zone 2-4, 5 times per week plus lifts 2, 3 times per week plus move hourly. 2. Hormones, sleep 7, 9H, lose visceral fat, lower cortisol. 3. Nerves/muscle, daily Kegels, protect the pudendal nerve, vary technique. 4. Nutrition, greens, omega-3s, EVO, eggs/shellfish/seeds, cut ultra-processed. 5. Smart add-ons, D3, if low, magnesium, L-citrulline, omega-3, VD/shockwave if indicated. 6. Reset, 30-day porn break if desensitized. If this helped, like the video, subscribe to Longevity Lab, and comment the one change you'll start today. Then watch our video, Top Testosterone Boosting Foods, backed by science, linked on screen and in the description, to stack the nutrition piece. Your 30-day reboot starts tonight. Disclaimer: this video is educational and not medical advice. Bodies differ. Before changing diet, supplements, training, or trying any device/therapy, talk to a qualified healthcare professional, especially if you have heart disease, diabetes, neurological issues, or take prescription medications.